subclavian vein just inside the chest wall. She had a mastectomy 20 years ago, probably has some scarring from her surgery that eventuated ultimately in an occlusion here. She developed right arm swelling, the entire arm. Clinically, you can tell that this is the problem because of the gorge veins on the right anterior chest and shoulder. And despite several vascular ultrasounds, 2 CT scans and an MRI, it didn't diagnose the problem, but the diagnosis was made very easily just on physical examination and history. We did a venogram a few weeks ago just like this. We ballooned it, we got a good result, but her problem recurred within 3 days. So today we're going to try stenting this, and we'll see how that works. If that doesn't work, then surgery is always an option. Just let it keep going, please. Jet, let it keep going. Right there, right there.
How's that? It's pretty close.
This particular stent they're using is self-expanding. It's sort of like Chinese finger cuffs, and it's constrained on the catheter, and there's like a sheath over it, and when it pulls back, it pops open and provides radial force against the vessel.
And you can see we've got really nice patency. This is what we had last time, only it lasted 3 days. There was obviously a scarred area because the balloon had a significant waist in the middle, and then as we got up to about 6 or 8 atmospheres, that finally popped open. So now we're going to put a stent bridging that area, a 10 millimeter stent that ought to give us some more radial force to hold that scar open.
See that top vessel,
Yeah, what
you
is
can
that?
kind of still see that was the collateral that was giving it the flow. Now that this is open, this 2 things: 1, the stent's covering it, and 2, the flow isn't necessary to go through there to get through, so it kind of shuts down or decreases. You gonna let her go home, or do you want to?
I am.
Ballooning inside of that stent to kind of fully expand it and push it up against the wall. But the way this stent is made, it has radial force that constantly goes to the outside.
14.
Stent has got the radial force in it. Actually, you could pinch it, but then when you release it, it'll pop back open. Unlike a lot of the other stents that if you crush them,
So this is the stent. This is the stent right here, and we balloon within the stent. It's wide open. Your collateral is no longer filling, which is a good sign she ought to have. Relief. Her swelling should be gone by tomorrow or the next day.